Hi mommies, this is Tamanna and Deva from Baby Destination. Hello. And we are very pleased to have with us today Dr. Anita Sharma. Welcome doctor. She's an internationally board certified lactation consultant and she's currently at Fortisla Farm at GK2 in Delhi. And she's here with us today because first week of August is the Breastfeeding Awareness Week. But here at Baby Destination, this entire month, we are doing a lot of awareness around breastfeeding, the issues that moms face initially when they start breastfeeding, how to get over that hump. It's not the end of the world, it's one of the most beautiful bonds that you can have with your child, and everyone gets through the hump. There's some issue or the other. We're both mothers. I'm mother.
We're all mothers.
We're all mothers actually. Yeah, sorry. We're like, I've exclusively breastfed my son for 14 months, even after I returned to work. Having said that, I had my fair bit of issues, and I actually took some time before taking professional help. I wish I knew Dr. Sharma back then, and so did.
Yes, I also fed my daughter till 15 months.
So yeah. So what we will be focusing on today is, initially we'll talk about how to start breastfeeding, right? How to initiate it. What are the triggers if it doesn't happen in a perfect way that we all imagine while we are pregnant, right? How to facilitate that. In the second section, we'll talk a little bit more about assisted breastfeeding, right? Which again is a way to help moms breastfeed longer. Our goal is clear. The longer we can exclusively breastfeed, without having a physical or an emotional effect on the mother, that's what we want to do, right? And in the end, we will talk about a breastfeeding, breast milk donation drive, which we are conducting this month, and we've had a very, very good response with mothers. So, doctor, what would you suggest in terms of, when you give the first feed to your child, how does it happen and
okay.
how do?
So the first thing is, even before we give the first feed to a child, it's documented and researched that mothers should be provided. In fact, not only mothers, but their whole family should be provided with breastfeeding education in the second trimester. So it's been researched and documented when mothers receive this kind of information, they are more likely to breastfeed their children. It is not the mother who has so much of an issue, it's the family around them. So therefore we now we now say that breastfeeding is not just the mother's job, it's a family-centric approach. So that all the myths and the doubts are clear. That is first and foremost. The second thing is, as WHO recommends, we would like the mother to put the baby onto the breast immediately, which is say within half an hour to the first 1 hour, because this again has been documented and researched to show that babies who are put onto the breast as soon as possible, the mothers lactate much better. As far as the attachment or latching is concerned, all babies have a instinct, which is they have reflexes which root the baby to the breast, and also a sucking reflex, which is present in all babies. And if you put a newborn to the tummy, they actually can crawl up, and it's a wonderful sight to see. So I've been working in this field for almost 3 decades now, and I have my children who are 27 and 22, and they've been exclusively breastfed for 2 years, so which surpasses your time frame, in spite of the fact that I have been working. So it's instinctive. Now the problem arises when these instincts are interfered with. So I always say, don't interfere with nature. Nature does not interfere with you. So you do find that as soon as the baby is born, they know how to get to the breast, they know how to suck, they know how to swallow. Okay? So that's a normal, natural phenomena, irrespective of the mode of birth that they've had. Whether they've had a section or they've had a normal vaginal delivery, the babies know how to get to the breast. So that's what it is. Apart from babies who may be preterm or, where we have some issues with the thing, but most babies can directly get onto the breast and they can latch on beautifully. Apart from the fact that you have few nipple challenges. Inverted nipples, like most people say, flat nipples are no problems at all as far as breastfeeding is concerned. The baby gets onto it immediately. Inverted nipples is an issue where it is a challenge, but definitely all challenges can be, if you decide you want to overcome it, you'll overcome it. There's no way in which you won't.
Wow, that's so true. I think what you said about instinct is very true. I can also totally relate to that. And this whole thing about, educating the entire family, even while the mom to be is pregnant, is very, very important. And this entire effort actually that we are doing at Baby Destination is because Philips is supporting a lot of this effort around breastfeeding education. We've been doing a lot of content around it, and thanks to Philips and also Fortis La Femme, because the entire breast milk donation drive is being done in conjunction with Philips, Avent, Baby Destination, and Fortis La Femme. One question that I have is, so in my case, I had a C-section, and I was separated from my child at birth because we also contracted some infection during labor. So due to which the first the first time that I pumped, which was the colostrum, the first sort of milk that comes out, was with the breast pump that they gave me at the hospital. And it was a very different sort of a feeling for me. I didn't know, but it did. When I saw something come, I was like, okay, it'll happen.
Yeah.
So what do you suggest? And we also see some questions around that, right? For whatever reason, if the mother cannot feed the baby right at birth, then what is the next best thing?
So see, if for some reason, which is usually if it's a preterm baby, or like she said, she had contracted infection, so the babies sometimes need to be observed in the nursery, and the mother is not able to go to the nursery to be able to breastfeed, then the next best alternative is that you pump. But here again, I just want to tell a mother that even if she was fortunate, if she got enough milk to be able to supply to her baby, but honestly speaking, the first time you will not have a volume to be able to get into the pump. So you do have special equipment which is like collectors, where you can collect the milk and you could feed them to the baby through a spoon, right? So because this would sometimes dishearten the mother if you don't see the milk on the first occasion. But the thing is, the fact that you are pumping, you're actually sending out a message to the brain. You're stimulating the brain to be able to make milk, right? So that is very, very important. So whether you do it manually or you do it through a breast pump, but you have to kind of tell the brain that my baby has arrived. Okay, so don't worry about the quantity of milk that comes out, but it is extremely important that you're stimulating the mind to be able to
pump. It's just that
let down the milk.
Yeah, and this thing about quantity, right?
Yeah.
So first time that you pump, or even if you feed, it's only a few drops that comes out.
Yeah.
I remember I was like, I told the nurse,
So
I was like, what the hell happened?
Yeah, so the colostrum is very, very little, and it most likely gets stuck over the pump also.
Yeah.
So don't worry on that.
Yeah.
Don't worry. It takes about 30 times before you actually see a volume of milk
build up
that flows in.
Yeah. And
Right?
baby's stomach is, they're so
Yeah,
tiny, right?
The
That
baby's stomach is really 5
Yeah.
to 7 ml, and
Yeah.
so we're not really worried, but we just want to make the best use of the hormonal changes that are happening in a woman, which is basically certain hormones are going down and certain hormones are coming up, which are actually promoting the let down of milk.
And actually we had this question from a mother who had specifically asked that, during pregnancy your breasts are so engorged, right?
Yeah.
So you feel that, okay, you've gone up 2 sizes, but then suddenly the milk that comes out is so little. So we had this question that, is it just me? And then they start stressing more. So please, ऐसा कुछ नहीं हो रहा,
Yeah, so basically, it's not engorgement at the time of pregnancy, it's more tenderness. And tenderness is the first sign of actually you're being pregnant. So when, if you hadn't had your chums, you'll find that your breast feels tender. So that is a time when the breast starts changing towards breastfeeding, right? And it prepares itself for breastfeeding. So the milk does not flow as long as the progesterone, which is one of the hormones which is high in the body. As soon as the baby is born, just before the baby is born, the level of the progesterone goes down. And that is where you will find that the milk flows out. So the oxytocin goes up in labor, and that is what releases the milk. So don't worry. And colostrum is very rich in fat. So even if you get a couple of drops, so we sometimes say you can even clean your hands nicely and make the baby lick whatever comes on. So that's also sufficient.
Good enough for the baby.
Good
right?
enough for the baby. Good enough for the baby.
So, doctor, the next set of questions that we have is around assisted breastfeeding.
Yes.
Right? And बहुत सारी moms हैं जो questions पूछती हैं. There is so around 4-5 months. Sometimes the breast milk supply has dropped either because they have supplemented it with something or due to some other reason. And उस time पे assisted breastfeeding, sometimes just because of that sort of signaling the body, does it help? And actually in my personal experience also, there was a time where I felt that my milk supply is going down, and because of I was guilty of not feeding directly in the first 24 hours. So then I felt if I don't feed exclusively for 1 year, then he'll keep falling sick. That was just, as a mother, I was going paranoid.
That's true actually.
So then when my milk started dwindling, because I used to pump at work, I started pumping a lot. Even after I came home, I started pumping, and I remember after 2 weeks my supply went up. So much so that then I was having a leakage problem. So ये problem actually काफी mothers को आती है, and then at that time unfortunately they're being forced into just because of family. Formula is still okay, but cow's milk is not, and they are being forced into cow's milk, and they feel very disheartened. They feel that I'm unable. So any thoughts on assisted breastfeeding there?
Yeah. So see, there are times when a mother is extremely uncomfortable, which is challenging, because this mother really wants to breastfeed. She's read about how breastfeeding breast milk is so important, and it does 100%. There's no substitute for breast milk. And so there are challenges, like I mentioned earlier, is an inverted nipple, where you would start pumping very much earlier, so that your nipples, there are twofold purpose of pumping at that go. One is that your nipple tends to protrude. Okay, it helps in pulling out the nipple, as well as it maintains your supply. Because if for any reason the baby is not latching well, or you find that the baby is not being able to suck, so you will find that your milk supply is not going up, right? So if the milk supply is not going up, you will find that more milk will not be produced by the body. So these are the times, or if you've been separated for neonatal jaundice and the baby has to be admitted for phototherapy, that's again a time where I would ask a mother to pump out her milk and give it to the baby, depending upon if she could go to the nursery and feed the baby at all times, wonderful. But if that is not possible, she could express breast milk and she could give it to the baby, because sometimes bilirubin levels are very high and we cannot take out the baby from the nursery every time for a breastfeed, because we want the jaundice to go down earlier. Besides this, you could, as she said, that there are times where the mother feels that, my supply is not enough, which is actually a myth, because if you're feeding your baby, your supply really doesn't go down. But instead of formula feeding the baby, in fact, so formula feeding, I wouldn't say that is also good. Okay, you could always top up with expressed breast milk.
Yeah.
So it is never substitution, whether it is formula, of course, never cow's milk, but so there is never substitution, it's always top up. And let the top up come from your milk. It's much better when it comes from your milk. So how do you get your milk? It's only through expression, which could be manual or through a pump. And because manual may be very difficult for some mothers and time consuming, so you may find pumping is easier. So that you could do. A mom who needs to get back to work would also require to pump. So milk supply does not go down with pumping, for sure. But the only
It
thing
only
is,
goes up. I mean, that has been our experience because,
Yeah.
we've seen a lot of these questions, and in some cases, there's some sort of foods recommended which may or may not help, right? That's not the focus of this discussion, but
Yeah.
the whole point is that we've then also gotten feedback from other mothers who, so I'm one, right? But other moms who've said that because of pumping, the supply went up. Because after 2 or 3 weeks, then they're able to see that if 30 ml was coming out in 10 minutes, now it's 40-45 ml coming out.
So you see, if you're doing breastfeeding in conjugation with the expression, because ultimately, as you all know, there is skin to skin. So skin to skin is something that gives you more milk. So when it's exclusively pumping all the time, you find the skin to skin is missing. And when the skin to skin is missing, what happens is mothers pump only 4 times in 24 hours. So that's when the supply starts dwindling, right? So if you're pumping, you have to do it minimum 8 times a day. So it has to be done 3 hourly.
Yes.
And if your baby is old enough, it has to be, you can take a 5-hour break at night, but you don't have to, like, just 2 times or 3 times will definitely reduce your milk supply. Because it's a matter of emptying out your breast so that
It
there's
can
more
refill.
space
Yeah.
to refill.
Yeah.
So that is the reason why you find when if at all mothers say that my supply is going down, or that myth around the pumping is because she is not pumping enough. And it has to be pumped like at least for about 15 to 20 minutes on each breast. And it is best done after you have fed your baby, until and unless you're at work. So if you're at work, that's the best form of maintaining your supply. And also to ensure that you're not formula feeding the baby and you're not giving any extra milk, you're just giving your own milk, which has no substitute.
Yeah.
It just has no substitute in terms of immunity, in terms of everything.
So actually this was the next question which was answered, that how often should you ideally breast pump if that's what you're doing, either because you're at work, and as you said 8 times, it's actually
Minimum.
Yeah, minimum, which
Yes,
when I was at work, I was pumping every 3 hours.
Yeah.
And then at night also when I was pumping extra, just because
Yeah.
when I
So
felt
it's 3 hours, 3
Mm.
hours, 3 hours, and just keep the baby with you, so that there's more skin to skin. Yeah. So that's extremely important.
Okay, so should we take some questions,
Yes.
some other questions, and meanwhile, while we're bringing up questions, we do want to let you know that we've started a breast milk donation drive, which throughout the month of August, and the response is very heartening. Right now, it's only in Delhi and Bangalore. It's very easy to donate breast milk. From Fortis La Farm, there will be a lactation counselor who will be coordinating the whole process. All you have to do is WhatsApp us on the number which we provide on this post, and then after that a breast pump could be delivered to your house. You can pump your house in your ease and put that milk in a sterile container, which will also be given. And that can actually save a baby's life, right? Because
Yeah.
the first feed, like in my case, I could not breastfeed.
So being a part of Amara, the first human milk bank in Delhi, housed in Fortis La Farm. So all I want to say is that you can donate extra milk that you have. Your supply doesn't go down. And the uniqueness of this bank is you do not have to even come to the hospital once to be able to donate milk. We do send a runner who collects the milk from your house, and he gives you the pump as well as the bottles to be able to express breast milk. You express the breast milk, we give you guidelines to store in terms of sterility, because obviously this milk is not going to every baby, baby, it's going to babies who are very sick. So we want you to take great care in the hand hygiene and how you are storing the milk. The runner comes back to you whenever your bottles are full. He collects the milk from you and it is sent to the bank where it is pasteurized. It is checked after pasteurization. It is checked for any infection and then it gets a green label to go. Now, as far as the going is concerned, the recipients are concerned, we do not give milk to anybody who walks up to us and says that we want milk. It is only given through the neonatal ICUs on the request of the neonatologist. He has to provide us detail of who he is going to use the milk for, because there's a lot of data that goes into the mothers who are donating the milk, as well as mothers who are babies who are receiving this milk, because we also want just you can send a scanned copy of your blood reports, which are 6 months is the viability of the report. If we feel that your reports are old, we send a phlebotomist to your house to collect the sample of your blood, so that we know that you're not having any infection. And then it is sent to it is again delivered by our runner to the NICU of that hospital, and it is he in turn explains to the sisters of the staff or the staff at the NICU as to how it is to be handled and it is to be administered to the little baby, simultaneously encouraging the recipient mom to also pump, because it is not something that can go on and on and on.
Yeah.
Because we've donated a lot of milk across the Delhi NCR, and we've collected a lot of milk from the mother, but this process has to be self-dependent. So it is usually given to the mothers only for a couple of days, when we find, as the Manna just said, that the first few days the milk was very little, right? So those are the times when we provide the milk for about the first week or 3 to 4 days, whatever, depending upon the state of the baby. And we have criteria for distribution, so we rest assured that the milk that you're giving to us is being given only to those children who really need it. It does not go to a well baby. It goes to babies who are less than 32 weeks of age, 35 weeks of age,
Wow.
or they are less than 1500 grams. So they are criteria of distribution.
Wow, this is, the last part even I did not know.
Yeah.
So
that's why I clarified.
That's
the
very
whole thing,
useful.
Being a part of Amara, I really wanted to clarify, because a lot of mothers come to me and say, oh, we can take milk from the bank. No, sweetheart. You're a well mother with a well baby.
Yeah,
you can pump out your milk. You can express out your milk. You can feed your baby, directly feed your baby.
Yeah.
And if there is a challenge, we're there to help you.
So I would really request, if I was lactating, I would have definitely donated. I actually had to throw away some pumped breast milk, but we actually think, maybe because we all are moms and we are wives, but we think that this is even bigger than blood donation or organ donation, right? Because there is no replacement, right? There is, and only a lactating mother can donate. So as much as I want, I cannot, right? Blood, still everyone can donate, and organs. So please, if you are a lactating mother, if there are any questions, you can talk to us directly, right? Either me or Deva or even doctor, right?
Sure.
Like if there is any question, we will directly answer that. So please try and sign up on the form and just do it. It's the most beautiful thing that you will do, right? And you can only do it right now.
I can only say that I have had mothers who lost their babies and have still donated their milk, and they said that this is the best thing we could do in memory of whatever happened.
Yeah. Wow.
It really brings tears to my eyes every time it happens. Every time I mention that. So, and you're helping a new life, a very, very timid life, which will go a long way.
And it is like, that's all they need at that time. Nothing else, right? There is nothing else. So,
exactly, nothing else. Because that is the only thing that actually helps in the development of a preterm baby.
Yeah. So I'm hoping after this, a lot of you mommies will sign up, right? And it's really my personal heartfelt gratitude to all of you who will choose to sign up and do this. And so Deva, should we take a couple of questions and then just maybe just 1 or 2 questions, because we are short on time?
Yeah. Moms are asking, like, what are the causes of sore nipples? Are these more common in the initial days after a baby is born?
See, the biggest cause of sore nipple, Deva, is a bad latch. Okay? So very often when you start breastfeeding, that's why again where family members and other people around you will say, no, it's bound to be a little painful. Thoda to dard hoga. No, it is not to be painful. if your nipples are hurting while your baby is being fed, that means you're not breastfeeding a baby. You're nipple feeding a baby. And I don't think we nipple feed a baby, we breastfeed a baby. So which means a larger portion of the areola has to go into the baby's mouth. So that is one major cause of sore nipples, but there are other causes like fungal infection, oral thrush, or you could have a tongue tie, or just so many other conditions like Raynaud's and things like that, where a mother could land up with a sore nipple. So all these things are definitely correctable if you visit a lactation consultant soon.
Yeah, I was going to say that actually, if any of you mums in Delhi or even otherwise, if not in Delhi, then can send us some questions, and if you're in Delhi, then do visit Dr. Sharma, because it will be a day and night.
Yeah,
right?
and the earlier you come, the better it is, because otherwise, it will be very difficult for you to give up.
Yeah. Okay, on that note, thank you so much, Dr. Sharma. Like, this is, even I learned so much more today, and thanks a lot to...
We'll be able to tell moms.
Yes,
exactly.
now we'll be like,
we will pass this information to
It'll be really nice.
Yeah.
We really want that more mothers come forward to donate milk. It really helps. We've seen that, and we are supplying to NCR all the hospitals. It's free of charge, and there's no money that is involved. So a donor mother does not get any money, and the recipient also, maybe if there are delivery charges, that's okay, or the charges that we use for the lab, but we don't. There are no charges at all. So that is what it is. We don't want money in the picture.
Sure. Thank you, and thanks a lot to Philips and Fortisla Farm, because this is a great initiative to just create overall awareness around breastfeeding, and also this drive.
Thank you,
So,
Tamanna.
thank you. Thanks.